Mrs. Tihaya will be the one to do or to execute this procedure, what we call the skeletal assisting skeletal traction. So first, I would just have to identify to confirm the patient's identity. So we'll be asking her name. So now, what is your name? Okay, Miss Tamara, I will be your nurse. I will be your nurse. I am your nurse for today, so I will be the one to do this procedure on you. So first, I have to gather the second is to gather the necessary equipment and bring to the bedside. So this is essential for this procedure to perform it properly. To ensure that the equipment has already been on its placed on its proper location. And then I will be doing hand washing. So assure that I have already been, I have done washing my hand. So next is to maintain the effectiveness of the traction. So I will check the traction apparatus to see the grooves are in wheel grooves of the pulleys. This is for the prior. This is for prior to the patient's safety. So the other one. So I have to check for the other one. Check for its strong capacity. And also, evaluate the patient's position. So I have to check for the patient's position. Next is never remove weights from skeletal traction unless a life threatening situations occurs. So I have to maintain the positioning. So check. Again, you have to check, assess for the position of the patient, and maintain alignment of the patient's body and traction as prescribed, and then position the patient's foot, and then protect the elbows and heels and inspect the progression. So you can use a towel or any convenient pillows that can secure the patient's mobility, including her elbow or any broke to these joints. And then encourage the movement without using the elbows or wheels. So, ma'am, can you use move your elbows. Okay, very good. Then assess specific pressure points or the scale tuberosity can show space, Achilles, tendon, and heel, or redness and skin breakdowns. Provide back care and keep the bed dry and free from crumbs and wrinkles if the patient is not permitted to move on one side or the other. All you need to do is to set the linens on its proper location. And then push down the mattress with one hand to relieve pressure on the back and both prominences if the patient cannot assist him or herself by holding the overload trapeze. So I have to use my one hand. You have to insert pressure on the mattress. Okay. For change of bed linens, let the patient raise the torso while one lays on the other side of the bed, rolls down and replace the upper mattress sheet. So I have to call for assistance. So I need to call my colleague, my partner in this procedure, Ma'am Rohay. Can you help me on this procedure? Yes. Hold on forward pa ma. Left, So the linings have already been placed on its proper location. So I have next is as the patient trays the buttocks of the mattress together with other nerves on the other side, slide the sheet under the buttocks. So that procedure is already been executed, and then place the sheet and blankets over the patient in such a way that the traction is not disrupted. And then next is to replace, of course, we have to replace the lower section of the bed linings while the patient's rest on the back. So, and next, I have to monitor for the neurovascular status. In this procedure, I have to assess the neurovascular status of the immobilized extremity at least every 4 hours, and then instruct the patient to report any changes in any sensation or movement immediately.
Instruct mo siya.
So ma'am, you have to move your any components of your body, compartments of your body, for you to determine if there is a dislocation or disjointing. And then encourage the patient to do active flexion, extension, ankle exercises, and isometric contraction of the calf muscles. This would also, it is preferable 10 times at an hour while awake, and give pain an hour while give pain medication as ordered before exercising or mobilizing the affected body parts. So next, I have to provide bedside care. So I need to wear gloves. So assume that I have already wear my gloves and cover the site with a sterile absorbent non-stick dressing and a rule gauze placed under the elbow of the patient. And then do aftercare, and then remove the gloves and do hand washing. So I have already removed my gloves and discarded to its proper receptacles, and then I will just have to wash my hand. And then after that, inspect the bedside every 8 hours for reaction. Example, thermal change that can occur at the bedside after insertion and infection. So next, I have to promote exercise to my patient. I have to assess inactive exercises, including pulling up on trapeze, flexing and extending the feet, and range of motion and weight resistant exercises for non-involved joints. And of course, while doing this procedure, you have to observe for the sign of pain. After that, I have to document all the procedures that I did, and including the skin and bedside assessment, and I help to try the patient's response to the neurovascular status of the affected area. So next is for the external traction. So what is this traction? So I have to elevate extremity after the external fixator is applied. If there are sharp points on the external fixator or pins covered with cups, so there is no sharp objects on the patient. So I have to monitor the neurovascular status of the extremity every 2 to 4 hours. And I have to assess each pen site for redness, drainage, tenderness, pain, or loosening of the pen. And then I have to notify the physician if signs of infection are presented, or if the pins or clamps seems to loose. Never adjust the clamps on the external fixator frame. And then I have to provide bedside care. So don and sterile gloves. So assume that I have already worn my gloves and clean each bedside separately 1 or 2 times a day with cotton tip applicator. Soak into a chlorophyll solution. And then I have to clean the bedside starting at the insertion area and working outward away from the bedside. Use a cotton tip applicator once. Then after using it, you can also use a another one cotton swab for each pen side. And after that, I have to do aftercare, remove my gloves and do hand washing, and encourage my patient to isometric and active exercise as tolerated. And I have to teach my patient to perform pen side care according to the prescribed protocol and to report promptly any signs of pen side infection, including redness, tenderness, increased or purulent pen side drainage or fever, and instruct the patient and family to monitor cardiovascular status and report any changes promptly. And then I have to document all procedures done, including sleep and inside assessment. So, and that was all for this procedure. Thank you.